Hello, my name is Dr. Michael Bartula, and welcome to My Health Navigator. This book was composed by myself, Dr. Mary Mignota, and Dr. Mike and it took 4 years of active research and 25 years of patient interaction and documenting what was going on with patients and developing a strategy and an effective strategy that works and works consistently. So in Chapter 1, we asked some very important questions. What are your health goals? Do you want to be disease-free? Do you want no pharmaceuticals? Do you want to live pain-free? Do you want more energy? Do you want to live longer? Do you want to increase clarity of thought? Do you want to be free of headaches? Do you want to exercise more? Eat healthier? Now, what are you currently doing, and how is that working for you? Are you looking at disease treatment? Are you trying to achieve symptomatic relief? Are you looking at disease prevention, trying to prevent a disease that runs in your family history? Are you looking at health optimization, trying to live longer, healthier, happier? And what is your health strategy? How do you intend to get from point A to point B? Now in Chapter 2, we cover naturalmedic.com's health strategy. This includes the health continuum, the health cup analogy, healing crisis versus disease crisis, the weakest link, and doctor as teacher, or docere. In part 1 of the book, we have identifying obstacles, and we have taken all the factors and categorized them into 5 main groups. And Chapter 3 is all about the environment and what factors in the environment that need to be addressed. And we have painstakingly gone through hundreds, if not thousands, of pages of information to be able to get the key points that drive home the message as to why this factor is important and why I need to take it seriously and need to look at it. And we've included references for your own perusal. Now in Chapter 4, we cover lifestyle factors, and we have choices and we have challenging habits. And the reason why they're called challenging habits is because sometimes these habits can take control and lead us down a path which is not good for our long-term health. The next group of factors, we have body. And this also includes what the labs mean. A lot of people have always wondered and consistently ask us, what does this mean? What does this mean, to try to interpret their lab information. So we have given a quick reference guide to be able to provide you with some background information as to what those actually mean. Now in Chapter 6, we cover mind factors. And all these basically create a stress response in us, and that's why they are so important. And our subconscious is key to understanding how we actually cope with these. In Chapter 7, we talk about spirit factors, faith, belief, and hope, forgiveness, and love, all of which are very important in our long-term health. Now in Part 2, we talk about your roadmap to success and how to achieve it. And this starts in Chapter 8 with recommended initiatives. Now key to this is the concept of changing habits. And in order to get you the long-term results that you want, there are definitely things that you need to look at changing in order to get you from point A to point B. And to help you on this path of change, we've created the rule of 21, changing habits. Some things that you need to know about habits. First of all, in order to achieve them, we need to know that willpower is finite. We only have so much willpower. So therefore, you only change one habit every 21 days. In order to establish a successful habit, it must take less than 21 seconds to initiate it, and to break oneself of an unsuccessful habit, it must take over 21 seconds to initiate it. So we need to make it very easy to get into good habits and very hard to get into bad habits. Now also there's a level of accountability. If we write things down, we attain 50% success. And if we have somebody hold us accountable, that ups it to 76% success. Now just writing it down and holding accountable, having somebody hold you accountable will get you those results. Now if you add that to the rest of the 21-second rule, we don't know what the long-term success rate will be. It could be up to 80, could be 85, could be 90, could be even 95% success in changing habits. Over time we will see, and hopefully with your success story. Now in Chapter 9 we talk about optimizing interventions, including detoxification, and other interventions that we generally recommend to patients. In Chapter 10, we cover naturalmedic.com treatments and try to provide you with as much research as possible for the majority of these treatment methodologies. I hope we've conveyed to our knowledge and understanding as to our philosophy and why each of these categories is important and the factors within each of these categories is important to be addressed to ensure long-term health. And our strategy to be able to get you from point A to point B. Our goal is to give life to the living.